What to do if you can't urinate vertical bar 8 tips for senior citizens. Let's start by acknowledging something important. The feeling of needing to urinate, but being unable to, is more than just uncomfortable. It can be frightening, painful, and deeply worrying. If you are experiencing this, please know that you are not alone. This issue, known medically as urinary retention, is surprisingly common, especially as we get older. Our bodies change, and the systems that have worked reliably for decades can sometimes need a little extra help and understanding. The purpose of this guide is not to scare you with complicated medical terms. Instead, we will walk through this topic step by step in plain and simple language. We'll explore the critical difference, understanding when this is a true medical emergency versus a frustrating ongoing problem, the why. Simple explanations for why this might be happening to you. The 8 tips. Practical, safe, and effective strategies you can use to help manage the issue, both in the moment and for the long term. Partnering with your doctor. How to talk about this sensitive topic with your healthcare provider to find the best solutions for you. Embarrassment can often be the biggest barrier to getting help, but your health, comfort, and peace of mind are what matter most. This is a medical condition, just like high blood pressure or arthritis, and there are excellent ways to manage it. Let's begin this journey to understanding and relief together. Part 1. The most important first step. Is this an emergency? Before we dive into any tips or long-term strategies, we must address the most critical question first. Your ability to recognize a true medical emergency could be life-saving urinary, acute, and chronic. It is absolutely vital to know the difference acute urinary retention. A true medical emergency, think of acute as meaning sudden and severe. Acute urinary retention. I completely lose the ability to urinate, even though your bladder is very full, signs of acute urinary retention. You have a sudden, complete inability to pass any urine. 6. You feel a desperate, painful urge to go. You have significant pain, pressure, or swelling in your lower abdomen, below your belly button. You may also feel anxious, sweaty, or have a racing heart due to the intense pain and pressure. What to do? This is not a wait-and-see situation. Acute urinary retention is a medical emergency. A bladder that cannot be emptied can become overstretched, causing damage to the bladder muscle. In severe cases, the pressure can back up to the kidneys, causing serious and potentially permanent kidney damage. It can also lead to a life-threatening infection. If you are seek immediate medical help, do one of the following. 1. Go to the nearest hospital emergency room immediately. Point 2. Call 911 or your local emergency number. Do not attempt to drive yourself if you are in severe pain. At the hospital, the medical team will act quickly to relieve the pressure. It will typically insert a thin, flexible tube called a catheter into your urethra, the tube urine from your bladder. The relief is almost instantaneous. Once the immediate crisis is over, they will work to figure out what caused the blockage in the first place. Do not try to tough it out at home. Do not drink large amounts of water to try and force urination, as this will only increase the pressure and pain to chronic urinary retention. A frustrating, ongoing problem. Think of chronic as meaning long-term and persistent. With chronic urinary retention, you can urinate, but you can't empty your bladder completely. Signs of chronic urinary retention. You're right after. You feel the need to urinate frequently, often in small amount. You have difficulty starting the stream of urine. This is called hesitancy. Your urine stream is weak, slow, or stops and starts. You have to push or strain with your abdominal muscles to get the urine out. You find yourself getting up multiple times during the night to urinate. This is called nocturia. You may experience leaking or dribbling of urine between bathroom trips. This is called overflow incontinence, as your overly full bladder leaks like an overfilled cup. What to do? Chronic urinary retention is not an immediate life-threatening emergency like its acute counterpart. However, it is a serious medical condition that requires a doctor's attention. Over time, it can lead to complications like or urinary tract infections UTIs. Stale urine sitting in the bladder is a perfect breeding ground for bacteria. Bladder damage. Constant stretching can weaken the bladder muscle, making the problem worse. Kidney damage. In the long run, pressure can still back up to the kidney. Bladder stones. Minerals in the leftover urine can crystallize and form painful stones. If you are experiencing symptoms of chronic retention, you should schedule an appointment with your primary care doctor or a urologist. A specialist in urinary system problems. This is where our 8 tips and lifestyle strategies will be most helpful. In managing the day-to-day ink dams. Why you work with your doctor. 2. Why does this happen? Common causes in senior citizens are standing. Why you might be having trouble urinating can be empowering. It helps you see that it's not a personal failing but a physical issue with a specific cause. Here are the most common culprits in older adults explained simply for men. The enlarged prostate, benign prostatic hyperplasia, beyond what it is. The prostate is a small gland, about the size of a walnut, that sits right below a man's bladder. The urethra, the urine tube, passes directly through the center of it. As men age, it's extremely common for the prostate to grow larger. This is a non-cancerous condition called BPIRD, how it causes problems. Imagine a garden hose. Now imagine someone is slowly squeezing that hose. That's exactly what an enlarged prostate does to the urethra. It constricts the tube, making it much harder for urine to flow out of the bladder freely. Bosis by far, the most common cause of urinary retention in older men. 4. Weakened bladder muscles. What it is. The bladder is a muscular sac. To urinate, this muscle, called the detrusor muscle, has to contract strongly to squeeze the urine out. How it causes problems. With age, just like any other muscle in the body, the bladder muscle can lose some of its strength and tone. It may not be able to contract forcefully enough to push all the urine out, leaving some behind. This is known as an atonic or lazy bladder. For both men and women, nerve communication issues. What it is. Your brain, nerves, and bladder are in constant communication. The brain sends a signal down the nerves telling the bladder muscle to squeeze, and the sphincter muscle, the gatekeeper muscle, to relax. How it causes problems. Many conditions common in seniors can damage these nerve pathways. Scrambling the signals. These include damaged nerves throughout the body, including those that control the bladder. Stroke or spinal cord injury. These can directly interrupt the nerve signals from the brain. Parkinson's disease or multiple sclerosis (MS). These neurological conditions affect muscle control and nerve signaling. Shingles. An outbreak near the lower spine can sometimes affect the bladder nerves. For both men and women, medication side effects. What it is. Many common medications can interfere with the bladder's ability to function properly. Seniors are often on multiple medications, increasing this risk. How it causes problems. Some drugs can weaken the bladder's squeezing power, while others can tighten the sphincter muscle, making it harder to open the gate. Common offenders include found in allergy and cold remedies, like Benadryl. The congestants, like pseudoephedrine, found in Sudafed. Certain antidepressants, especially older types called tricyclics, anticholinergics. This is why tip number 6 is so crucial. Never assume a new urinary problem is just old age. It could be a side effect of a new medication. For women, pelvic organ prolapse. What it is. The pelvic floor is a hammock of muscles that holds the bladder, uterus, and bowel in place. After childbirth, menopause, or due to aging, these muscles can weaken. This can cause one or more of these organs to droop or prolapse. How it causes problems. If the bladder, a condition called the cystocele or uterus, drops, it can create a kink in the urethra or press against it, blocking the flow of urine, much like a kink in a hose. Differs. Constipation. What it is. A hard, full rectum, the final section of the large intestine, sits directly behind the bladder. How it causes problems. When the rectum is packed with stool, it physically pushes against the bladder and urethra. This pressure can be enough to pinch the urethra closed, making it very difficult to urinate. This is a very common and often overlooked cause of urinary trouble. Also causes urinary tract infections, UTIs. Severe inflammation from a UTI can cause swelling that blocks urine flow. After surgery, anesthesia can temporarily put the nerves to sleep, including the ones controlling the bladder. Pain and swelling after pelvic or abdominal surgery can also make it difficult to urinate. Bladder stones or tumors, while less common, a physical blockage inside the bladder can also prevent urine from draining. Now that we have a better understanding of the potential causes, let's move on to the practical, actionable tips you can use to find relief. Part 3. The 8 core tips for senior citizens dealing with urinary difficulty. Here are 8 detailed, practical strategies to help you manage chronic urinary retention and improve your bladder health. Remember to discuss these strategies with your doctor to ensure they are right for you. To tip 1. Master the art of relaxation and create a calm environment. The big idea. Your body cannot perform a relaxed function, like urinating, when it is tense and stressed. Anxiety about not being able to pee actually makes it harder to pee. The key is to trick your mind and body into a state of calm. Why it works? Urination is controlled by 2 sets of muscles working in harmony. The bladder muscle detrusor needs to contract, while the sphincter muscle at the base of the bladder needs to relax. When you are stressed, your entire body tenses up, including that crucial sphincter muscle. It clamps down tight, refusing to open the gate. By focusing on relaxation, you are consciously telling that gatekeeper muscle that it's safe to open. How to do it? A step-by-step guide. 1. Ensure privacy and time. The feeling of being rushed is a major source of tension. Go to the bathroom when you won't be interrupted. Lock the door. Tell your spouse or family member you need a few minutes. Don't go right before you have to leave for an appointment. Give yourself the gift of unhurried time. Point 2. The warmth technique. Warmth is a powerful muscle relaxant. A warm bath or shower. If you are at home and have time, this is one of the most effective methods. Sit in a warm, not hot bath for 10 to 15 minutes. The warmth envelopes your pelvic muscles, helping them release their tension. Many people find they can urinate right in the tub. You can simply rinse it out afterward, or a warm shower with the water running over your lower abdomen and back can also help. A warm compress. If a bath isn't an option, soak a washcloth in warm water, wring it out, and place it on your lower abdomen just below your belly button. The gentle warmth can help relax the bladder and surrounding muscles. Point 3. Mindful breathing. This is a technique you can use anywhere, anytime. Sit comfortably on the toilet. Close your eyes. Place a hand on your belly. Inhale slowly and deeply through your nose for a count of 4. Feel breath for a count of 4. Exhale slowly and completely through your mouth for a count of 6. Feel your belly fall. As you exhale, imagine all the tension in your pelvic area, your thighs and your abdomen just melting away. Repeat this 5 to 10 times. Don't focus on trying to pee. Focus only on your breath. Option. The stream will start on its own once your body is relaxed. Point 4. Distraction is your friend. Sometimes, the more you think about urinating, the less you can. Distract your brain. Read a few pages of a magazine or a book. Listen to a calming piece of music or a podcast on your phone. Solve a simple word puzzle in your head, shifting your mental focus away from the performance anxiety, natural reflexes to take over. Why? This is especially helpful for seniors. As we age, we can become more prone to anxiety, especially around health issues. This creates a vicious cycle. You worry you won't be able to go, which causes tension, which makes it impossible to go, which increases your worry. Breaking that cycle with relaxation is the first and most fundamental step. 2. Practice smart hydration and mind your diet. The big idea. What, when, and how much you drink has a direct impact on your bladder. The goal is to keep your urine diluted and your bladder happy without overwhelming it all at once. Why it works. It might seem counterintuitive to drink fluids when you feel full, but dehydration is a major enemy. When you are dehydrated, your urine becomes highly concentrated. This concentrated urine can irritate the lining of your bladder, making it feel like you have to go more often and potentially causing spasms that interfere with normal function. On the other hand, chugging a huge amount of water at once can overfill the bladder too quickly, stretching it and making it harder for a weak muscle to empty. The key is balance and timing. How to do it? A practical plan. 1. Sip, don't gulp. Instead of drinking 2 large glasses of water with meals. 2. Gentle tapping. While sitting on the toilet, use your fingertips to gently but firmly tap on your lower abdomen directly over the area of your bladder, midway between your belly button and your pubic bone. Tap repeatedly for about 30 seconds. This can create a mild vibration that stimulates the bladder muscle to contract. 3. Gently but briskly stroke your inner thigh. This can stimulate the nearby sacral nerves, which are involved in bladder control. 4. Perineal pressure for men and women. The perineum is the area between the anus and the genitals. Reaching down and applying gentle, firm pressure to this area can sometimes help relax the sphincter and initiate urination. 5. The whistle while you work method. Trying to whistle a tune can force you to relax your jaw and abdominal muscles, which can in turn help relax the pelvic floor. It's another form of distraction and relaxation combined. Why this is especially helpful for seniors. While slower with age, these external sensory cues can provide the extra push needed to get the message through to the bladder and start the flow. They are simple, non-invasive, and can be used anywhere. 4. Partnering with your doctor. When home care isn't enough, while the 8 tips above are powerful tools for managing chronic urinary retention, they are not a substitute for proper medical care. It is essential to work with a doctor to diagnose the underlying cause of your problem and develop a comprehensive treatment. Preparing for your appointment. To make the most of your visit, come prepared. Bring your medication list, as detailed in tip number 6. Bring your bladder diary, as detailed in tip number 3. Be ready to answer questions the doctor will likely ask. When did this start? Do you have pain? Do you leak urine? How many times do you get up at night? Have you had a history of UTIs, kidney stones, or prostate problems? Do you have any other medical conditions, like diabetes? What to expect at the doctor's office. A thorough evaluation might include physical exam, including a lower abdominal exam to feel for a distended bladder. For men, this will likely include a digital rectal exam, bladderus, to check the size and shape of the prostate. For women, it may include a pelvic exam to check for prolish. Urine test urinalysis, to check for signs of infection, UTI, or blood in the urine. Bladder scan. This is a quick and painless ultrasound. The doctor or nurse will place a probe on your lower abdomen after you urinate. A machine will instantly measure how much urine is left in your bladder. This is called a post-void residual, or PVR. This is a key test to confirm chronic retention. Blood tests, to check your kidney function. Prostate-specific antigen test. Based on these results, your doctor may refer you to a urologist for more specialized testing, if needed. Kamali medical treatments. If lifestyle changes are not enough, your doctor has many effective treatments to offer. Medications. For enlarged prostate, by Tamjulas and Flomax work by relaxing the muscles at the neck of the bladder and in the prostate, opening up the channel for urine to flow more easily. Catheterization. If you are retaining a large amount of urine, a catheter may be needed. Intermittent self-catheterization, ISCC. This may sound intimidating, but it is a very common and manageable technique. The doctor or nurse will teach you yourself to drain your bladder on a schedule, e.g., 4 to 6 times a day. This ensures your bladder stays empty and healthy. Many people find it gives them a tremendous amount of freedom and control. Indwelling catheter. In some cases, a catheter that stays in place for a longer period may be necessary, but this is usually a short-term solution, or for people with severe unmanageable retention. Surgical and procedural options. For men with BPH, There are many procedures, from minimally invasive like Urlift or Resume to more traditional surgery, like a TURP, that can remove or reduce the obstructive prostate tissue. For women with prolapse, a supportive device called a pessary can be inserted into the vagina to hold the organs up, or surgery can be performed to repair the fist floor. The inability to urinate can feel like a loss of control, and that can be one of the most difficult parts of this condition. But I hope this detailed guide has shown you that there is so much you can do to take back control. Start by understanding if your situation is an urgent one or a chronic one. Then, begin to patiently and methodically incorporate the 8 tips into your daily life. Relax, drink smart. Create a schedule, fix your posture, move your body, review your pills, fight constipation, and use the simple tricks that work most importantly. Please do not let embarrassment hold you back. Talk to your family, talk to your doctor. Urinary retention is a common, treatable medical issue. By working with your healthcare team and being a proactive partner in your own care, you can find significant relief, protect your long-term health, and continue to live a full, comfortable, and dignified life. You've stiff knowledge. Now you can take action.